The session today is about our opportunity to share with you our Directorate Social Care Plan. It's at a draft stage at the moment, but we're really keen to make sure you're contributing. So the slides that you'll have today that we're sharing with you is the full summary. It gives you the headlines, the key things we're focusing on. But what we're really keen to do is make sure from a provider view that we're capturing your thoughts on it. Now, our plan does include what matters to people who use services alongside their families and their carers. So what it means for people, for carers that are looking after loved ones, our partners, our own staff, and partners in our external service. Those partners that are delivering the care and support on our behalf. So today's session is aimed at yourselves to see what you think, see how much you understand about the plan, and whether you feel that it's we're going in the right direction, but our approach as well is the right approach. We want to make it capture all the things that you've talked to us about. So we've just had 2.5 years living with COVID. You've been supporting us to deliver services. So we're really keen to ensure that it picks up the impact of the implications of living with COVID and what that means going forward. Many of you have already spoken to me about the workforce pressures, recruitment retention issues. So those kind of things we want to make sure have been captured. The PPE issues, the testing, visiting. So those you need to vocalise your thoughts on whether we've pitched that right or whether we've missed anything. So social care is really a big spectrum, as you know, and everybody has a personal or professional interest in what happens in adult social care, because it impacts either directly or indirectly. For you, it impacts directly. So again, it's about capturing that as providers, what it means for you, what it means for your residents, your service users, the people you're supporting on our behalf, what it means for those people that you're supporting that are self-funders as well, that don't directly come to us. So again, capture all those views and feed that back into this approach. As I said, we've got session in the session today, we've got opportunities for you to interact and give us your views, but use the chat function as well. If there's anything you want to say so we don't miss it, please feel free to use the chat function, and Peter will be checking that throughout to make sure we've captured that. We will continue to hold a number of sessions till the 11th of September, and some of those will be aimed at people who directly receive services, so they can share their views as well. So I think the only other thing I needed to say on the very first one is take your opportunity today. We're hoping if you could wait till the end of the session to ask formal questions, but capture them. Don't lose them, because we need that richness of conversation today. So there's our welcome slide. As with everything, it's an hour and a half, but I know how busy you are. So just like we had the session the other day, if you need to nip off to take 5 minutes, please do, but come back. Is that okay? So who we are, Adult Social Care Directorate. You will know, many of you will know how the directorate works in terms of its teams, but I will just go through this. So there's a lot of teams within adult social care, and they're generally the ones that you'll have already been working with is the social work teams. We have a range of social work teams, some that focus on older adults, others that focus on specialists like mental health teams, who assess and plan the support with the individuals and their family. So those I know that you're familiar with, because you often get social work visits and you have conversations. We also have occupational therapists who assess and support with daily living skills and look at enablement functions and see how people can maximise their strengths and abilities. Clearly, there's a commissioning team that you have contact with us on a regular basis, and we arrange the services and we contract monitor the services as well as quality assure those. So again, you all know that the quality team, and you have a link from the quality team, and they work with you to make sure that the service you're delivering is delivering on good standards and safe standards of care. Brokerage, you're all, well, I know you're familiar with brokerage because you often communicate with our brokerage function, but they are the team that find the services and support the individual with the packages as assessed by the social work team, and they're the ones that you have your first point of contact with in terms of placement. So that's the summary of who we are. In terms of what our teams provide, we provide a range of services. Oh, Peter, can I just ask you to pop back to the last page? Thank you. Oh, just back, if you don't mind, Peter, back.
Sorry, I'm just going to unshare because I can seem to go forwards but not backwards. Bear with me.
Oh, bless. Okay. So whilst Peter's just reading the slides, can I just welcome the colleagues that have just joined us? We do apologise for the technical problems, but I can see other people have joined us. So we're having to revert to a Teams meeting, and hopefully that will be more interactive. I don't know if Peter's been able to do that, so I'll go on to... thank you, Peter. So in terms of our teams, we provide a lot of a really broad range of services, from equipment to aids and adaptations to support people's independence, and again maximise their strengths and abilities, so that we're enabling people. We have a range of services that support people with learning disabilities and specialist residential homes as well. We have short-term services that we provide as well as longer-term, and we have an in-house reablement service that a number of you work with, and then we have a range of day opportunities. We work closely with other organisations who provide social care, such as yourselves, so dom care, care homes, supported living, as well as working with our wider health organisations, so our ICB, who used to be CCG partners, hospitals, GPs, our primary care services such as support to care homes. So our partnership is wide and it is much more of a holistic approach. Peter, happy to move on to the next slide, please. So in summary, our directorate plan, if we share it as a plan on a page, this is pretty much the summary, and some of this my colleague Caroline will go into a little bit more detail as we go through the slide deck. So we have a vision, the start of our directorate plan, which is about making a difference to individuals, but in the right way and every day, and that is that focuses more on an enabling approach, so that it's the right support at the right time and it works for the individual. Our purpose, again, this is just summary and we'll go through a little bit more, is to enable people to stay as independently and as well as possible, and safe. I think that's the other bit, and as safe as possible, with supporting their choice. Where people do need long-term support, it has to be timely and proportionate and responsive. Our purpose is about good quality services that enables people to continue to live their lives the way they want to. So that again is about choice and some control. And we want to work, and we want to work together respectively in a joint way that recognises diversity, compassion, and is inclusive. So that's our purpose, and that purpose hasn't changed. It's our continued purpose. In terms of our vision and approach, we continue to emphasise our values of being open, honest, ambitious, and keeping our promises. We use a strengths-based approach, so maximising people's abilities, supporting individuals to be as independent as possible, and recognising their abilities and their support networks. And a number of you know have already been working with us on those. In terms of our priorities, which we update annually, these are our key priorities that have continued to be our priorities for a couple of years now. Equality, diversity, inclusion, that underpins everything we do. Our own approach to high performing teams, to making sure we offer the best and do the best we possibly can. Engagement, so we are actively engaging in and gathering views and voices of people who use services as well as people that deliver services. And environmental sustainability, so that we are working with colleagues and looking to see how we make sure that we're as green as possible, that we are encouraging that to happen with the services we commission as well. But again, Caroline will go into a little bit more details as we go on. And then in terms of resources, we will share with you a little bit about our resources. Our budget at the moment is 60 million per year, and our expenditure is 103 million. The difference is because we get income from the NHS and social care charges for people that do receive services, and in addition we have specific government grants, and this supports approximately around about 8,000 people with care and support needs and carers annually. There are currently around 5,000 social care staff in Solihull, and about 470 of these are directly employed by the council, so some big numbers there. And then in terms of our key projects, which again, as I said, we will go into a little bit more detail. We've got a number of key projects there that I won't talk to you about because I know Caroline will go into it more detail. So next page, slide please, Peter. So in terms of facts and figures, there's the plan does include lots of data, so it's really important for you to have a look at the plan. We have in Solihull, we have around 215,000 residents. Of those, 45,000 are aged 65 and above, and of those, 6,500 are in the upper age quartile of 85 and above. So this age group is actually growing quite fast, and it's we're one of the local authorities that does have an older aging population. In terms of diversity and understanding our changes in terms of ethnicity, we're expecting 1 in 5 of our population to be from a different ethnic minority background by 2029. So again, seeing a shift there. Around 4,000 people that we within Solihull have a learning disability. And again, it's just us in terms of planning our directorate plan and planning forward, making sure that our services reach all of the Solihull population. The pre-pandemic had around 20,000 adults under 65 had a diagnosis of mental health condition, and 2,000 adults were under 65 had a diagnosis for autism. So big numbers there that we need to be supporting people going forward. And again, some of those will come out a little bit more as Caroline talks through some of our detail of the plan. And we estimate we have around 27,000 unpaid carers in Solihull. So those are people looking after their loved ones, to keep them supported at home. So big numbers there again, and how we support unpaid carers going forward. Next slide, please, Peter. Again, as we've said, our vision and purpose, our ambition is about making a difference in the right way every day to enable people to stay as independent and as well as possible and as safe. that when they do need support, it's timely and proportionate. So it's where they need it rather than taking over. It's responsive to what people are asking for, and it's tailored in a way that continues to support them live the lives they want to. Now, our approach is about delivering this together as part of a partnership, and working with providers and health partners, and making sure that's delivered in a respectful, compassionate way, recognising people's differences, embracing those and delivering on diversity, and making sure we have staff across internal and external that are able to achieve this. Again, we talked a little bit about our values and our approaches earlier, and hopefully you'll have already seen this in terms of our values, that we're open, we're honest, we're ambitious, because we want to keep delivering and achieving the best we possibly can for our citizens. We want to get the best out of the pound for our public purse, and we want to work well with you as our partners, and again keeping our promises and feeding back in terms of where we are on our journey collectively. So we want to support people, again, to live the lives they choose to live. We don't intend to take over, and we don't intend to have a dependency model. We will continue to focus on supporting choice and promoting independence safely, encourage people to intervene early and ask for help early, which includes information advice, so they can take control, and then look for solutions, so that when they do need to come to us, it's because they really need some additional support. Look at the way that each person can do what they can do for themselves, and look to enable support from others, the wider community, their family, their friends, so that adult social care is involved proportionately. And again, as we've said, support carers and families in their caring tasks, and work with partners like yourselves to continue to promote the wider health and well-being that underpins people's ability to deliver on their own daily living skills. So I'm going to stop there, and I'm going to pass you over to my colleague Caroline, who will take you through the next set of slides.
Thanks, Safina. So this is our delivery model. This is how we're going to try and communicate with our residents about the spectrum of social care, about our universal services, which are our prevention and information and advice services, and we've given examples of those and the kind of outcomes that should come from them, through to the more targeted support, and then finally the specialist support, which is more likely the support that yourselves would be delivering, to try and get people to think of adult social care not just as that final endpoint of being in a care home or needing care coming into your home, but to try and get people to think about the early point and getting advice and support early to make sure that they're making good choices and they're able to keep their independence for as long as possible. Next slide, Peter. And then we also felt it would be helpful to share with people about how we spend our money in adult social care. A lot of the time when people think about adult social care, they think about care homes, and they often think about older adult care homes. So showing people these figures and showing actually, they might find surprising that we spend more money on younger adult care homes than we do on that for older adults, but also the growing amount we use for accommodation with support. So that could be extra care housing, supported living, as well as our care at home support and other things. So it's just to give people an idea of how that spread of funding is used in adult social care. And as you can see, the vast majority of it is on the services that we commission. Next, please. So Safina's touched on our enabling priorities. So these are the priorities that we're setting within our teams, within our staff, to make sure that we're doing the right things and we're going about it in the right way. So equality and diversity inclusion, Solihull is changing rapidly, and we expect when we get the full outputs of the 2021 census data, it will show the scale at which Solihull is changing, but we need to make sure that services are reflective of the diverse population that we've got and the increasingly diverse population that we've got, and that the services meet people's cultural needs, meet people's preferences in terms of how they're supported and what that looks like. Then high performing teams, that's the standards that we set ourselves, that we expect the best of our staff, and we expect everyone to be working in the best way, and to be able to demonstrate to our residents that we are doing that. The third is engagement, and this is part of that strengthening of engagement, that we want to be coming out, speaking to residents and to providers more and more. So we're going to be shortly launching a new engagement approach with residents, but also you've got the provider forums and meetings that Safina runs, and we're trying to do more and more of that engagement, either face-to-face or like this in a virtual setting. And then the final one is environmental responsibility. I think we've all felt in the last month or so the impact of climate change. We need to find ways to not only support our residents to cope with that changing climate, but to do our part in trying to stall that changing climate. So how can we deliver care in a greener way, acknowledging obviously all the challenges that we've had with COVID and the rise in the use of single-use plastics in our PPE. So we've got a lot of changes to make over the next 5 years, and there's a lot of national requirements driving those changes. I'm sure you're all thinking about fair cost of care and also funding reform being a couple of those key national changes, but actually there was more in that in the white paper that came out the end of last year as well. As we make those changes, we want to continue to improve and build on what we've got that's good. And we're really interested in comments and feedback from you about how we can do that. We've done a 5-year summary which sets out the overall direction. That's our forward view, which I'll take you through next. And then after that, I'll take you through the key projects for the coming year so that you can see how that forward view plays out in the immediate time. So this is our 5-year forward view. So these are all of the big things over the next 5 years which are changing what we're doing. So the first one is obviously delivering on our vision. It's fine to say we're making a difference in the right way every day. We need to make sure we are. So making sure that we're working to keep people as independent as possible, getting the right advice and support and preventative services that keep people living well. Then it's about the care that we want. So it's developing the services to meet the diverse needs of our community. So making sure that we understand what that needs to look like and that we work with yourselves to make that a reality. Social care reform is going to be a massive change in terms of how we interact with our local residents. The cap on care costs will bring lots more people, and the change in the thresholds too will bring lots more people into contact with the local authority than are currently. That means we need to be ready to deal with that. We need to be ready to work with you all on that. And as guidance continues to come out about social care reform, we're trying to understand what that will look like and make sure we're prepared for that. NHS and joined up working with our partners. Obviously, the integrated care system launched on the 1st of July, and we're working with that new integrated care system to look at how do we work together better, how do we ensure a better flow through for things like hospital, but where people use both of our services, how do we join up in a much more seamless way for our residents to make sure we're getting the best outcomes. Good quality care and support. Obviously, you know, we do a lot of work around talking to you all about quality of care and trying to support that, having a quality care market. We've also got the fair cost of care exercise and a market sustainability plan that we're developing at the moment and working on. And if you participated in that fair cost of care exercise, thank you very much. That's going to be partly in preparation for reforms, but it's part of that longer term view about making sure that we have a sustainable care market that's able to focus on delivering good quality. We're also looking at new models of care. So how can technology and digital solutions support people to maintain their independence? And how can housing, thinking about the people at the heart of care white paper, and its focus on every conversation about care should be a conversation about housing. How can housing help really make sure that people maintain their independence, and the right housing support people to live better and more independently? Safeguarding and safety, obviously a core role for adult social care, and something that will be continuing throughout this, as we'll have to adapt to the move to liberty protection safeguards as that comes in. We're also looking obviously to be always improving. So we benchmark our performance against similar councils, and we're looking at where people do better than us. How are they doing that? How can we emulate that? How can we get there? So always looking at whether there are better ways to do things. And working as a whole health and social care system to be financially sustainable, because obviously we're a council, we've got duties, we have to set balanced budgets, we need to be able to afford what we're doing. So how can we make sure that the care system in Solihull is financially sustainable? So for 2023, our key projects, workforce strategy, I'm sure a lot of you will be familiar with, looking at how we can help in terms of recruitment and retention, making sure we've got the right skills in the local market. And we've got some pilots going on at the moment to explore ideas that are in that strategy to see how they can work and how deployable they might be across the whole care market. We've got a carer strategy and development that will be being published later this year. We're working on developing our home first approach with our NHS partners. So how do we make sure that we've got really strong pathway 1 and pathway 2 services and flow in and out of them to really make sure that people don't stay in hospital any longer than they have to, and if at all possible they go straight home. Fair cost of care is a major piece of work currently, and we're looking at how can we make sure that what we're paying is the right figure to make sure that services are deliverable at what we're offering at a good quality. So we're working through a lot of returns right now, trying to understand how costs are made up, how costs vary, and what a fair position would be. Home living adaptations, we've got a really good equipment and adaptation service. It's not always used to the maximum. How can we make sure that we're really maximising the use of equipment and adaptations to keep people in their homes and to make sure those homes are suitable and not providing a hazard in and of themselves? Social care reforms are going to be a really complicated change for people. Obviously, everyone's seen the headlines about you won't have to sell your home to pay for your care. The small print is a fair bit more complicated than that. So there's going to need to be a lot of work with residents and with care providers as we understand the detail of how those care accounts are going to have to work and how those reforms are going to be, to make sure that we're all ready and prepared for that new system. Exploitation reduction, we're trying to make sure that our vulnerable adults are kept safe from exploitation. So some of this work is around working with those vulnerable adults themselves. Some of it is about increasing awareness of the signs of exploitation and making sure that people are aware and flag up people that they think are at risk and can see some of those dangers. And then the final one is, as I said, environmental sustainability. So what can we do to deliver care in a more environmentally friendly way? How can we support that environmental agenda moving forward? Because we need to protect our climate if we're going to stop some of our most vulnerable people feeling some of the extreme impacts of what a poor environment can do. And we've had floods in Solihull, we've had heat waves and power cuts associated with those. We need to take action on that. Okay, so that is the end of our high-level run through of what's in our directorate plan. We'll now open the floor to questions, comments, anything that you'd like to feedback to